Hi everyone, we are going to talk today about the prognosis, that is the scope of treatment for conditions like fissure-in-ano or anal fissures and fistula-in-ano. These are the two common conditions affecting the lower gastrointestinal tract or the rectum or the anus, and that of people around 15 to 18% of the world population seem to be suffering with fissure-in-ano, and that requires treatment. My name is Dr. Rajesh Shah. I am a medically trained homeopath and director of Life Force, where we treat patients from across the world. Based on my experience of having treated a lot of patients of this condition from across the world in the last 35-37 years, I'll share some brief prognostic notes. Fissure-in-ano and fistula-in-ano, they are essentially medico-surgical conditions. It means many of them are likely to end up into a surgical condition, then the medicines will not really do the job. When we use homeopathy, we are looking at trying to manage these two diseases using homeopathic medicines and trying to see if we could save those cases from surgery. So in our experience, the fissures, if they are not very severe, if they are in the early stage, mild relatively, then they can respond extremely well to homeopathic medicines. Homeopathic medicines can heal those fissures or cuts around the anus. In case of fistula-in-ano, which is nothing but a kind of abnormal passage, abnormal canal or abnormal formation in the rectum, which leads eventually to infection and pus formation and discharge of pus and blood, and that doesn't heal easily because it is exposed to various infections in that area, and eventually that may end up requiring a surgery. All in all, in the early cases of fistula-in-ano, and if they are not multiple, then homeopathic medicines have shown significant benefits, and many cases have been found to recover from fistula-in-ano using homeopathy, and surgery could be avoided. However, if the fistula is very large and multiple and non-responding, then they may require surgical correction. How do we define the prognosis? The prognosis by and large we could define in terms of A, the complete curability, 2, the symptomatic relief, 3, partial recovery, 4, reducing the drug dependency, 5, avoiding surgery, or 6, incurable or not able to help the patient. In case of fissure-in-ano, I would say early cases it can respond very well symptomatically, as well as healing could happen, and later cases may require symptomatic relief or may require surgical intervention. In case of fistula-in-ano also, symptomatic relief is possible, complete recovery is also possible in the mild cases, and the ultimate severe cases and multiple fistulae not responding to medicines, they may require surgery, and only those cases may require surgery, I would say. Otherwise, there is a potential that homeopathy could really help both these conditions. What is the length of duration of the treatment recommended for these conditions? Well, I would say it depends on the patients and the extent of the disease. But by and large, one may require 3 months to maybe close to 1 year of treatment to bring substantial changes in these two conditions. Is it recommended? Yes, homeopathy is strongly recommended for both these conditions in different stages, especially in the early stages of their development and progress. I hope this helps. Thank you.